Hey everybody, this week we are going to do parasitology. So I just have the PowerPoint here that should be in the course for you under week 2. All right, so let me just move something out of my way there. Okay, so we're going to get started. It is a long PowerPoint, so just bear with me as we go through it. It's going to seem overwhelming, kind of like mycology. Usually parasites are harder for people than mycology because there's more. But again, it's all about picture identification and just remembering little key parts to it here and there. So that's it. You're not going to have to memorize all of these slides, but it's just knowing little key items here and there as we go. So I will definitely try to highlight or stress anything that I feel is really important. All right, so we'll start the show here. All right, so parasites are essentially classified into 6 divisions. You have your protozoa, which consists of your flagellates and ciliates, your nematodes, which are more the roundworms, platyhelminths are flat worms, and so on, as you can see there. Some terms that you will hear throughout parasitology, if you do reading, any of that, anytime we refer to something as being an obligate organism, it means that it can only live inside of a host. It needs something to live inside. Facultative can live in or outside of the host, it doesn't matter. Endoparasites are, of course, within the body. Ecto is on the body surface. Definitive host, that is the portion of where the parasite lives its adult sexual stage at. Intermediate is its asexual stage. And finally, reservoir, again, anything that can harbor the parasite. So these are just informational terms that I wanted to make sure that you had the definitions of for when you do any reading or look up anything. All right, so we are going to start our parasites off with the amoebas. Amoebas, I don't know if you remember back to high school biology, but this is something you probably covered back then. I mean, I actually do remember covering this, which I don't remember much from high school, but I remember this. But amoebas are single-celled and they move by pseudopods. So they kind of look like blobs, really. So they look like these big blobs, but they can stretch out what we call pseudopod, and that is how they move. Typically, we are going to pick up these amoebas that we're going to talk about through fecal-oral ingestion of what we call the cyst form. The cyst form is going to be like the younger stage. So we'll have the cyst and the trophozoite stages. You'll see those words in a minute. But cyst is younger, trophozoite is more like the adult. Just keep that in mind. And again, all of the parasites, most of them are fecal-oral ingestion. Just to be aware, a lot of diarrhea here happening with these. I will mention if it varies from the fecal-oral, but for the most part, it's fecal-oral. We're dealing with samples, stool samples with diarrhea kind of deal. Out of the amoebas, the biggest, #1 clinically significant parasite is going to be Entamoeba histolytica. It is the cause of amoebic dysentery, so some nasty diarrhea, and amebic liver abscesses. It can actually get into like the bloodstream and go to the liver and then cause abscesses there. Other amoebas, there's lots of other amoebas. We still need to know about these, but they're more non-pathogenic. They're not as clinically significant. So we have Entamoeba dispar, Entamoeba hartmanni, you'll for sure want to know. Entamoeba coli, you'll want to know. Endolimax nana, and then Iotamoeba bushlii, and you will want to know Iotamoeba bushlii. And again, I'll stress as we go. This is just what the liver abscesses look like when Entamoeba histolytica infects the liver. Okay, again, we're talking about trophozoites and cyst stages. Trophozoites is more the adult stage, if you want to reference it that way, just more easy terms. Typically, they're larger because they're an adult, so 15 to 30 micrometers. This is where they really look like amoeboid-like. They're really blobby looking. I know blobby is not scientific, but it makes sense. Inside, they do have a single nucleus, and that nucleus will have a small central karyosome. The karyosome is just where the chromatin is. As you guys learn in hematology, nucleus have chromatin inside them. And in this case, with the different parasites, they'll be as like a single dot called the karyosome. Inside the what we call endoplasm, you can also think of it as like cytoplasm when we talked about cells, but in this case, it's their endoplasm. So basically all the surrounding stuff around the nucleus, that can contain different debris and erythrocytes, so it can ingest things into the amoeba as it goes. All right, so in this case, we're talking specifically about Entamoeba histolytica on this slide. So just keep a note, Entamoeba histolytica is the one that's 15 to 30. And it's a very key characteristic that Entamoeba histolytica trophozoite stage has those ingested erythrocytes. Not all amoebas will do that. Entamoeba histolytica is like the only one really that I need you to remember that will have ingested erythrocytes in its troph stage. So that is a big key characteristic. All right, so here's what it looks like. Blobby, right? Looks blobby. So you can see its nucleus. But if you look at the very bottom picture, all those dark are the red cells that ingest it. So you can see that there, how it does that. All right, the cyst stage for Entamoeba histolytica is going to be spherical, or you can call it round. Inside, they will have some chromatoidal bodies, about 1 to 4 nuclei, and each one of those 1 to 4 nuclei will have a central charysome again. The chromatoid bodies is bolded here because it's a key characteristic of the Entamoeba histolytica cyst. So if you look here, you can see those dark chromatoid bodies in the different ones. If you look at the upper right, it's there. It's just not stained very well. And again, 1 to 4 nuclei. So you can definitely see that on the upper left, you see 1, 2, 3 nuclei. On the upper right, you see 1, 2 nuclei. And the bottom one has 1, 2, 3, it looks like, on the edge there. It's hard to see on that one. You'd have to probably focus up and down with your microscope. So there's a textbook drawing. It goes from the trophozoite down to the cyst stages. And then there's actual pictures from stool samples. So, okay. So those are the key, knowing the key characteristics of the trophozoite stage and of the cyst stage. As far as life cycle overall, again, it's fecal oral ingestion. So somehow your hands are getting infected with cysts from these Entamoeba histolytica, and when you eat, whenever you put anything up to your mouth, it's going in. That's why hand washing is always so essential. It's surprising how many people don't wash their hands. And then that cyst, once it gets down into your stomach, it actually is very resistant to the acid down there, so it can easily go into the small intestine without getting destroyed, and then it just sits and lives and multiplies. And that's where it's going to start to do its damage, where it causes the dysentery, where it can get into the bloodstream from the intestine to go to the liver to cause more damage, that kind of thing. So you really don't have to memorize this life cycle. You just have to know what it causes, which is we've already discussed amoebic dysentery and liver abscess. So this is a nice picture representation of how it multiplies, how it gets from one to the liver, staged liver via circulatory, that kind of thing. So it's just informational to help you put it all into perspective. All right, as far as diagnosis goes, anytime we're diagnosing any sort of parasitic diarrhea-like infection, history of, like, especially if they traveled, is huge, because a lot of these parasites aren't really found in the United States. There are some, but where the majority are found are more south of us, like Central America, like Dominican Republic, South America, you know, there's other parts of the world too, but like that's where travel becomes so big, the history of the patient. So that's one of the things we want to make note of is if that patient traveled and they have diarrhea, it might be important to know where they traveled to and have an idea of, oh, maybe we do have a parasite because they went to, say, you know, Puerto Rico or something on a vacation. All right, to actually diagnose it, though, we're going to, of course, get stool samples. If they have diarrhea, it should be easy to get a stool sample. They should need to go. Just the same as when we looked for bacteria causing, you know, different diarrhea illnesses, we would get a stool culture. In this case, we would get a stool sample. It would be put into a jar that has a preservative already in it to help, you know, preserve any parasites. And then everything is done under the microscope. Microscopic identification is key with these parasites. So let's see, yeah, we're good there. So I said there's a lot other amoebas that we need to know, and this is a nice chart from the book that summarizes the troph and the cyst stage and the key characteristics that goes with each one. I think this is really helpful because not only do we need to know size becomes important when we measure different parasites if we find something to help differentiate what it is. You need to know size, you need to know how it moves. That is important in amoebas. Entamoeba histolytica is a more progressive directional movement. It has purpose. If you look at the rest of the Entamoeba, or the amoebas in general, it's all non-directional, slow movers. They don't do much. So know that Entamoeba histolytica definitely has purpose to it. The others don't really as much. Again, Entamoeba histolytica in the troph stage has the ability to have ingested red cells. If you go down the list here, none of the others do that. That's very unique to Entamoeba histolytica. And then as far as the cyst stage goes, this tells you 1 to 4 nuclei, and then it has those chromatoid bodies, which it shows in the diagram here. And it tells you the chromatoidal bars is a whole category. Other ones can have chromatoidal bars and have different amounts of nuclei, so that's not as unique to Entamoeba. You just need to know it does exist. If you look at Entamoeba coli, that can have up to 8 nuclei. That's very unique for Entamoeba coli. None of the others have that many in the cyst stage. Entamoeba hartmanni, you'll definitely need to know. And again, Iotamoeba bushlii, the neat thing there, and I think we'll get to it, is they'll have a large glycogen vacuole. This last category is called glycogen vacuole, and it says a single defined, and it's right there, that big white space, and you'll see it on the pictures. It's very obvious, and that's the key with Iotamoeba bushlii. The only one off this chart that I really don't test on is Endolimax nana. I really don't ask you any questions on that one. So let's get through these. So here's that Entamoeba coli cyst. I mentioned this is the one that can have up to 8 nuclei. Now, of course, when you're looking at this under the microscope, you're using your fine focus to look at it up and down, because you're not going to be able to see all the nuclei in just one focus. So right now, I can see 1, 2, 3, 4. It appears there might be 5, 6, maybe a 7th. If I were to focus, I bet I could see the rest of those there. And then again, Iotamoeba bushlii, this is the one with that very characteristic glycogen vacuole. On the bottom 2 pictures, you can really see it there. And so that's a key characteristic for Iotamoeba bushlii. And then finally, the other one I said to know is Entamoeba hartmanni. What I use to identify this, and I don't think it ever says, I can't remember if it even says this in the textbook, it's just that I've noticed it throughout pictures of seeing it over and over again, is that its nucleus, the ring around it, is very heavily defined. Like, again, I'll have to look to see if it ever even mentions that in the book. I don't think they use that as a characteristic. I just have always used it as just a telltale sign. It just seems to really set it apart for me than the others. So I've always noticed it has this really heavily ringed look around its nucleus. It's a very dominant looking nucleus ring. So that's what I use as a key to tell Entamoeba hartmanni. The other thing with Entamoeba hartmanni, if you go back to the chart, is it's small, very small. When you look at the size compared to the others, especially in the Trophozoite stage, it's a lot smaller. So know those 1, 2, 3, 4 amoebas. Again, the only clinically significant one was the Entamoeba histolytica. The others aren't really as pathogenic. Okay. Now we do have another category of what we call the free-living amoeba category, and there is one here that I want you to be aware of, and it's called Blastocystis hominis. It is clinically significant. We will see about 6 to 40 micrometers as far as the size, and this has a very key characteristic to the look of it, which is nice and bolded down there for you. Basically, in the center of this parasite is a central body that kind of looks like a vacuole, but it really isn't. It's a central body. And because it takes up the space inside of it, it pushes the nuclei to the edges of the cell because they can't really be in the center since the body is taking up all the room. So the very unique thing is those nuclei will end up on the edges. I'm like, I thought I had better pictures of that, but if you look at this one, you can see, I hope you can see my arrow there, circling right where one of those nuclei is, right on the edges. It's hard to see, I know. So the way that students have remembered this in the past is they say you blast the nuclei to the edges so that they can remember it goes with Blastocystis hominis. So there you go, edges. This one is stained, but if you see the little purple dots, that's the nuclei, and then the blue is the rest of it. So the little purple dots on the edge, do you notice how they're all on the edges only? That's the nuclei. And that's all you have to remember with Blastocystis hominis. All right, the other free-living amoeba was Acanthamoeba. This has more spiky pseudopods. It is clinically significant. It causes granulomatous amebic encephalitis. So an encephalitis essentially affects the nervous system. I do not test you on this one though, so don't worry about it. I don't test you on it just because there's 20 zillion parasites out there and we had to pick what ones we're going to focus on, and so I am not focusing on this one at this point. Naegleria fowleri. This has been one that has made the news a lot up in the Midwest lately. It seems like every summer, gosh, for a few, and I'm probably exaggerating, but I feel like once every summer I hear of somebody getting this. So this is definitely clinically significant, another free-living amoeba. So again, it has that pseudopod, blobby shape to it, but it can actually transform into a flagellate and move by flagella then. And this causes primary amebic meningoencephalitis. So people, when they get this, are getting it from swimming, especially in brackish water. Brackish water is typically a mixture of salt and fresh water. Obviously in Minnesota, we really don't have brackish water. It should be mostly fresh. And Minnesota and Wisconsin, it's colder. That's why it's so surprising that this has been up there, because it typically likes warmer climates. But lately, there's been a few different news stories in Minnesota and Wisconsin. Take a look where children are swimming and they get this from swimming. It either goes up in their nose or in their mouth if they got their mouth open. And unfortunately, it goes right to the brain. And it does that meningoencephalitis, lots of inflammation, extremely severe, fatal basically. Like it says at the very bottom, fatal within a week of symptoms. Very sad story with this. This is obviously not something we're diagnosing in diarrhea. You're seeing it in CSF fluid. Cerebrospinal fluid is where you would see it, or there's probably other technology that they use because they're going to look like they have meningitis, headache, fever, stiff neck. So if they ran a CSF, you would see it there. So parasitic meningitis. So take a look at some stories. Now, this will probably freak you out and be like, I'm never going to go swimming in my life again. You have to remember how many thousands and thousands of people swim all the time in the summer in Wisconsin, North Dakota, Minnesota, South Dakota, and none of them get this. It doesn't happen. It's very rare, but it has been happening. It's like in our little bit of colder water up there, which is kind of sad. It's a very sad story. So just something to be aware of. Now, I don't really test you on this information, but I want you to be aware of because it's been hitting news lately a little bit more. So just something to be knowing, especially as you begin to work in the labs in your future. All right, on to the flagellates. We're all done with our amoebas. We're going to move into the parasites that move by flagella. So these are going to be intestinal flagellates that we'll start with. And again, fecal-oral ingestion. Giardia lamblia is going to be probably our most common clinically significant parasite throughout this whole thing. Most common, I should say, throughout this whole thing. And this is probably one you are more familiar with, is Giardia. And then Dientamoeba fragilis is the other clinically significant intestinal flagellate. So those two are our clinically significant ones out of this grouping. So the only note here is Dientamoeba fragilis actually has no known cyst stage at this point. They haven't really pinned its cyst stage down yet, so it's just a troph form that we look at. So we're going to start with Giardia. This has a couple other names. You might hear it as Giardia duodenale. Oh my gosh, these names. Duodenalis or intestinalis. But basically, like I said, it's the most common for the U.S. I should have added that on. Most common parasitic type of disease for the United States. It causes gastroenteritis and some traveler's diarrhea. It loves to be found with beavers. They're a good reservoir for it in the lakes and ponds. Typically, you're getting Giardia through contaminated water. Contaminated well water has been well linked with this. So it comes through that, gives you diarrhea. The trophozoite form is very unique looking. Nothing else looks like this. This should be really identifiable to you guys. It's about 9 to 21 micrometers long, 5 to 15 wide. You don't even have to remember those numbers. But basically, it's got this pear shape with these two nuclei that look like eyes. And you're going to see what I mean in a second. Then it's got a long axoneme, which is down the center, and two curved bodies, and basically flagella coming out at all places. And when it moves, it has like a falling leaf movement. So there's what it looks like. And do you see those two nuclei that are what we call the eyes? Giardia is often referenced to as the old man. And when it looks like it, he looks like an old man. He looks like he's kind of staring you down. I'm going to show you. I'll come back. If you look on the left there, he's stained. He's a little bit prettier looking to see. And then at the bottom, he's got flagella. There's probably flagella coming out the sides. It's just hard to see. But yeah, there's our little old man Giardia. All right. And then for a cyst stage, again, cysts are more round. He will have 4 nuclei, 2 median bodies here. The way that I explain this, I think the black and white pictures are the best pictures here on this slide, is I feel like in the center, especially if you go over to where it says F there, that third picture over on the black and white, in the center there with those median bodies and the nuclei, I feel it looks like a flower, right, with the little leaves, and then the petals are the nuclei. So I always just remember that when I see the cyst, I look for the little flower inside to know it's the Giardia cyst. If you look here, again, the troph is the pear old man look, and then on the right is his little flower in the cyst. So that's how I always remember it. So hopefully you should definitely be able to recognize both the trophozoite and the cyst form for Giardia. There's this life cycle, again, contaminated water. It can come through some contaminated food, but contaminated water is the biggest way it comes in. Dientamoeba fragilis, again, more diarrhea. It's an intestinal flagellate. You know what it does when it gets in the intestines, diarrhea. No cyst stage. In the trophozoite stage, this is going to look like amoeba, and it's called Dientamoeba, but it's technically a flagellate. You're not going to see the flagella on it. It's going to look more blobby like the amoeba, but it does move by flagella. And the key characteristic with this is these inside the nuclei has 4 to 8 chromatin granules. So there on letter A, you can see there's 4 big blobs. Those are the chromatin granules inside the nucleus. On the right, letter B, there must be either there's 2 of them together, or there's just one big blobby looking one. It's hard to see, but you can see the 2 different nuclei both have the chromatin granules inside of it. There's a stained representation. On the left, it has 2 nuclei. On the right, just 1 nuclei with 3, at least 3, it probably does have a 4th there, chromatin granules. So that's the key in knowing Dientamoeba. You can see how blobby it looks, still like the amoebas, but it's technically a flagellate. So be very comfortable with Dientamoeba fragilis as well. All right, Trichomonas vaginalis. So we're moving on with our flagellates. We're now no longer in the intestines. We're on other flagellates. Trichomonas vaginalis sounds like what it's going to infect. It infects the vagina. It's actually an STD. It's a sexually transmitted disease. You can find it in men and women. It's found in the genitourinary tract. A lot of times it might be associated with people with gonorrhea, but you can still get trick without having gonorrhea. It's definitely an STD all on its own. We commonly just call it trick. So if you ever hear that, that's the STD. The technical name is Trichomonas vaginalis. It will give, for women especially, will have a discharge with this. It'll be, those are some icky words, but it'll be a creamier, smelly discharge. Sometimes men can have a discharge as well, and sometimes men will have no discharge. That's where, for men especially, it's really tricky. A lot of times they don't show symptoms, and that's why it's so essential they still go get checked. The biggest key with Trichomonas is, again, it's a flagellate, but it will have this undulating membrane on the side of it. And this one as well has no known cyst stage, so we're only worried about the trophozoite stage. And I'm going to skip ahead. So there is the undulating membrane on the side, that kind of like wave, and then you see the flagella. I'm sorry, I will come back, I promise. I thought I had a real picture of it. I do not have a real picture, but just on this slideshow, I think I have one on a different slideshow. Just remember the undulating membrane for Trichomonas. The other Trichomonas was Trichomonas hominis. This also has no cyst stage. This is more non-pathogenic, so we're not as concerned about this. It will look very similar to Trichomonas vaginalis with that undulating membrane. All right, Chylomastix mesnelii is another flagellate. It's also pear-shaped. Inside it has this classic, what they call shepherd's crook. If you think about, who is it? Mary Had a Little Lamb song. You know the outfit for when she dresses in that big old-fashioned dress and she had the big hook? That's a shepherd's crook with the curve at the top. That's what it is. So in the trophozoite stage, they're said to have this shepherd's crook look. In a cyst stage, they're said to be more lemon shades, kind of with a knob at the end. Again, this is non-pathogenic, nothing that we're too concerned about for disease. And there it's showing the cyst stage. It's supposed to be lemony looking. Doesn't look lemony to me, but you get it. All right, so there's a nice chart summarizing all of them up, so make sure you're good with those. Yes, I would know all of those, just so you're aware. All right, going to our ciliates. We only have one ciliate that we're concerned with, one organism that's pathogenic out of the ciliates, and that is Balantidium coli. As it sounds, they move by cilia. It has cilia covering its surface. Again, all about fecal-oral transmission, so you're looking at diarrhea. It is a very large parasite. So the trophozoite stage will again be covered by cilia and has a very classic bean-shaped macronucleus. So we'll have this really large nucleus that looks like a kidney bean shape, and then it does have a smaller, just round micronucleus, and that is the key on knowing Balantidium coli. So there it's showing you your big kidney bean macronucleus with the micronucleus, and there's a picture of it in real life. You can definitely see that macro kidney bean shape look. Very stands out, so definitely be good with that one. And again, disease-wise, diarrhea. Here's some others. I think the one, the B on the right, is easier to see that nucleus in. The one on the left, letter A, kind of got mushed into the coloring, but it's there. Moving into blood and tissue, so we do have a little bit more flagellates that are infecting your blood and tissues as it sounds. These are going to have some different terms. We've been talking all about trophozoite and cyst stages. Now we're going to go into trichomastogote and amastogote stages. So amastogote stage is going to be an obligate parasite where they have to be inside of a cell to do its, basically, to do its like replication, to remultiply, that kind of thing. The trichomastogote stage is what we can see in the blood or the tissue fluid or whatever it might be. That's the stage that we can see under the microscope, is the trichomastogote. So this is just showing you basically the ones that we're going to mainly be concerned about here. It's going to be Leishmania and Trypanosoma. Those are going to be two of the big organisms we talk about that fall into this category. So again, you can find tissue, blood, cerebrospinal fluid, and these are very much passed by insects. There's specific insects that pass them. So as we go, we will talk about what these are passed by, just to kind of create that clear. So we'll start with Leishmania. There are 4 different Leishmanias. We have Tropica, Braziliensis, Mexicana, and Donovani. Again, the amastogote form will be inside cells, and we're going to see that with, I think we have a picture of macrophages with this amastogote inside of them. The Leishmania are passed by sandflies. I would definitely remember that. That's big, that they are passed by sandflies. And so we'll start with Leishmania tropica. It's causing what we call cutaneous leishmaniasis of old world. Essentially over like Asia area is what they mean by old world. So the other side of the hemisphere from us, so Asia, that kind of area. And it's very much causing a big old skin ulcer there, nasty little bugger. Leishmania braziliensis causes the New World, so over in South America, Central America, again, very much lesions on the skin. You can especially see it on the face and extremities, it says, even on the ears. But Leishmania mexicana causes mucocutaneous leishmaniasis. So as the name suggests, it is found in Mexico and also Central South America. In this case, it's affecting the mucocutaneous layer, especially like your nasal mucosa, your mouth, your oral mucosa. So you will get lesions of that tissue, and a lot of times it does result in what they call gross disfigurement. You can see that easily in the picture. And then Leishmania donovani is visceral leishmaniasis. So this is many different areas, so it's not just one side of the world or the other. And this is the one that will delve further than the tissues. It will go actually into your different organs. And all those lesions that you saw, like on your skin, the skin ulcer lesions and all that, it can do that same thing only to your organs on the inside, to your liver, to your spleen. So you can see where it's really not just troublesome, but very concerning. So fatal within 2 years, it says, if not treated. And you have to remember, A lot of times where these things are being discovered, they are more third world countries. So think about, what is their healthcare like there? Probably not very good. What is their access to money and being able to get healthcare for themselves? Do they have the money? A lot of times not. So you have to remember things like that, because a lot of people are like, isn't it treatable? Well, yeah, they have great healthcare and money and insurance, but a lot of times where this occurs, they don't have that like we do. So you got to always keep that in mind. All right, so there's again the Leishmania life cycle in general, passed by that stand fly. To diagnose it, we are looking at skin lesions, biopsy, because that's where we're seeing the sores, is the big lesions on the mucocutaneous, the skin ulcers. So we can take biopsies of that, look at it under the microscope for the Leishmania parasites. So there's a little Leishmania parasite. They look kind of harmless. That, I would believe, is the amastigoform. That's the one that has to be inside the cells. So you can see it here. These are macrophages, and they're all up inside these macrophages. So definitely know the Leishmania picture. There's a really nice picture of how it's inside there. All right. And then Trypanosoma, another blood and cerebrospinal fluid flagellate. This is passed by a couple different bugs depending on what disease it is. So the Trypanosoma brucei gambians and the Trypanosoma brucei rhodesians are passed by the tsetse fly. And they result in the sleeping sickness. So gambians goes with West African sleeping sickness, and rhodesians goes with East African sleeping sickness. Both of them pass by the tsetse fly. This is only in Africa. We don't have this over here. And then the other one is Trypanosoma cruzi, which is passed by the reduvid, or what you can call a kissing bug. This is in America. We do have this parasite in the United States, and it causes Chagas disease. There was somebody famous that had this, a famous scientist that had Chagas disease, and now I'm totally blanking out who it was. Look it up. See who the scientist was that had Chagas disease. Now I'm like, oh, total brain fart right now. But there's what the kissing bug looks like if you want to be aware of it. And the penny's there for size. I feel like I see that all the time outside, but I'm probably imagining other bugs to make it look like that. I feel like there's a ton of bugs that look just like that. We have these ones around here that have red on the backs of it that look similar to that. All right, so a little bit more on the sleeping sickness. This is basically where Trypanosoma brucei will invade the lymph nodes, leads to fever, you know, all the lymphadenopathy, which is enlarged lymph nodes, all the kind of sickness signs. And then later it starts to really involve the central nervous system. That's where they get the fatigue, that's the sleeping sickness part, mental dullness, increased sleepiness, and finally coma and death. So it all begins with that tsetse fly bite, which passes the Trypanosoma brucei to the patient, and then they start going through the stages. There is a classic stage sign called the winter bottom sign, which is a post-cervical lymph node enlargement, and you can see it there. I don't test you on the winter bottom sign. It's just a kind of an interesting note. There's the overall life cycle, starting with that tsetse fly, and that's what the darn bite of that tsetse fly looks like. Nasty. All right, as far as remembering, I'll come back to where I was. As far as remembering what is West African and which one is East African, you do need to remember what goes with what. Students in the past, or actually, no, I did make this up. I like to always say the road heads to the east. So I always know rhodesians goes with East African sleeping sickness. The road heads to the east. I don't know, it's a stupid saying, but it works. It works for me. So then I can tell them which one's apart. All right. Back to where we left off. Detection, you can detect it in the blood, so if you do a smear, you can see it in there. You can also see it in the lymph fluid or through cerebrospinal fluid because it does involve the central nervous system. We are looking at the tripomastigoform, which is the one that doesn't have to be inside the cell. It floats without the cell. And Trypanosoma is pretty identifiable in a picture or under a slide. I think it looks like little seahorses. I think they are so cute until you remember what they do, but they are so cute. So they look like a little seahorse. So to have at the end there what they call this posterior kinetoplast. It is a flagellate. It have a single large nucleus. But just remember, it looks like a little seahorse. There's some others. Isn't that cute? Aw. All right, I'm off of it. All right, Trypanosoma cruzi, again, this is the one that's with Chagas disease, particularly with children. It involves multiple organ systems. And then it will start basically with the skin phase, what they call the Romanos sign, which is swelling of the eyelids especially. And then it can lead into the chronic phase, which involves more the heart, the CNS, that kind of thing. So there's the Romanos sign, the extreme swelling of the eyelid. And there's the life cycle of Trypanosoma cruzi. Again, passed by that reduvid bug, or you could call it the kissing bug. As far as diagnosis, again, we can see this under a smear in the tripomastigote form. It's said to be more of a C or U shape, but let's be honest, you are not going to be able to tell me that's more cruzi and the other ones were more brucei. Just call it trypanosoma and be done. You'd have to do further, like, have you traveled, where have you been, further investigation to know which ones it is. There's probably antibody tests they can run, but basically, when you see a picture of trypanosoma, you're not going to be able to tell me one's cruzi, one's not. Just say it's trypanosoma in general, just because they look identical, little seahorses. All right, malaria, you should have definitely learned this already in your hematology class. If you've taken hematology, maybe you haven't yet. But there are, again, 4 species of malaria: Plasmodium falciparum, vivax, ovale, and malariae. Falciparum is about 50% of the cases that we see in the United States. We do have a lot of people that travel or move here from parts of the world that have malaria, so you definitely have to be aware of it. I've had a good friend that has seen it in northern Minnesota who works in a lab. I also had a student who went to the North Dakota State Department of Health lab for her micro-rotation in Bismarck, and she saw malaria. She was so pumped. Not for the patient, but pumped. So yeah, we definitely can see it up in Midwest. So you do need to know about it. All right, let's see. So hopefully this is review, but malaria, again, passed by the Anopheles mosquito. That is not a mosquito we have over here. This is more found in Africa, the Mediterranean, Southeast Asia, parts of that area that have it. It will start just like any kind of infection with headache, nausea, fatigue, malaise, just don't feel good. They will go through cyclical fever and chills. So it will not be a steady fever and chills with malaria. It'll be cyclical. So as these malaria parasites use the red cells to reproduce themselves, and then they lyse them, they destroy the red cells, and then go out, find another red cell to go back into. As they are lysing those red cells, that's when your fever and chills are occurring. So it's not a straightforward fever chills all the time, it's only when those cells are getting lysed. Other symptoms, you know, seen there, whatever, you can ignore that. The biggest key stages with malaria are going to be your ring stage, and then your gametocyte stage with falciparum especially. But there's all sorts of stages you can see in the blood. I don't really test you on the Schizant stages. It's more the ring stage and then that gametocyte stage in falciparum. This is just describing the different stages, what they look like and different characteristics. Remember, out of all 4, falciparum is the worst for infection. It's the most significant infection. And that's because it involves all ages of red cells, whereas the others have preference to certain types of aged red cells. So there it's walking you through the different stages. Letter A is the ring stage to definitely be aware of. More stages. So this was malariae, and it has in letter A, it's showing you the trophozoite stage with the band across it. That is a characteristic stage for Plasmodium malariae, is that band across the red cell there. So do remember the band to the trophozoite stage for malariae. Plasmodium falciparum, again, this is the only one that can have 2 chromatin dots in the ring stage. All the other plasmodiums only have 1 chromatin dot in the ring stage. So this is one of the ones that can have 2. It kind of looks like little headphones. And then letter B is showing you the gametocyte stage. That is a very characteristic finding of Plasmodium falciparum, is this banana-shaped gametocyte right here. That is so classic for falciparum. Babesia should have also been learned in hematology if you took it. This is another parasite that's passed by a tick. Definitely seen in the Midwest with Minnesota, Wisconsin. We have a lot of ticks. Also seen with New England, anywhere that has ticks really a lot. Passes the parasite, again, malaise, fever, chills, that kind of thing. So again, you're going to see it under the microscope. It does have a ring stage, so Babesia and Malaria in the ring stage can look just alike. They're hard to tell apart. And again, that's where travel comes in big. If they've never been outside the United States, it's probably Babesia, not Malaria. But there is one characteristic look that Babesia gets that's called the tetrad or the Maltese cross. It's nice and bolded for a reason there. So you can see it, if you look on the right, I'm circling the cell where you can see the 4, the tetrad. That's the classic look of Babesia, a good finding for it. You see on the left all the ring stages. Again, it looks really similar to Plasmodium. Toxoplasma gondii is the big one with why pregnant women cannot clean cat litter. I don't know if you ever knew that. If you've been pregnant, you've known that. This is the reason why you can't clean cat litter when you're pregnant. Oh, darn. So it causes toxoplasmosis. So this isn't too big of a deal to adults. It causes more of like a mono infection where you're just really tired and like you have enlarged lymph nodes. It's the baby that's the big risk, and that's why pregnant women have to be careful because, like I said, if you're immunocompromised and congenital, which is the baby, are most at risk. So you will transmit this through fecal-oral route, which if you're cleaning cat poo, that's fecal. So, and the other ones to be aware of is gardening. A lot of times people like to use manure and things in gardening. Don't do that. Sandboxes, oh my God. Sandboxes are like a big old cat litter box outside. So just be aware of that. You are not going to need to know these pictures. They look similar to Leishmania, though, when you look at it, doesn't it? But do not worry about the pictures for Toxoplasma gondii. As far as diagnosis, a lot of times we just take a tissue biopsy or more easy, a blood test with looking for antibodies levels to see if you've been exposed. When you first get pregnant, they usually do a panel on you, a test to see if you have positive to any of them. One of them is Toxoplasma gondii. It's a panel that was called TORCH. The T was for Toxoplasma gondii. And like the C is cytomegalovirus, you know, that kind of thing. So they're looking for a panel of infections to see if you've had any. Coccidia. So there's 3 different organisms that fit into this category. We have Isospora, Cryptosporidium, and Cyclospora. These are more seen with immunocompromised patients, but can be seen fecal-oral. So Cryptosporidium parvum, definitely found with waterborne outbreaks causing diarrhea. I would remember this, that I would remember. And then it's passed as oocysts, and these oocysts will contain sporozoites, kind of similar to Plasmodium life cycle if you've learned that. But we stain this actually with an acid fasting to look for it in the feces. So there's what it looks like with acid fast on the right. On the left is the unstained. You do not need to know the picture of Cryptosporidium parvum. Just remember it's linked with waterborne outbreaks. There's another picture of the acid fast. The red is the Cryptosporidium. All right, Isospora belli. It was called Isospora belli. Now they call it Cystoisospora belli. You will forever hear me call it Isospora belli, so just get used to that term instead. This looks just like Cryptosporidium parvum, so you're not going to be able to tell them apart. And again, comes from waterborne outbreaks, diarrhea, just remember that. Oh, actually, no. I do want you to know this one. To me, this does look different. It has these 2 sporozoites in the center there. Do you see that? Sometimes you can have just 1 sporoblast, but it'll have 2 sporozoites in the center. Here's a sporoblast in the center. I do need you to know this. I feel that this is very easily recognized. To me, this one's easier than the Cryptosporidium. So I want you to know Isospora belli here. And then Cyclospora cayetanensis comes from all sorts of contaminated fruits, or some veggies. Makes you almost not want to eat any of them because I love strawberries, raspberries. This is just why you make sure you really wash your fruit well before you eat it. You never know what's on there. Let's see. Also very similar to Cryptosporidium. That's what it looks like. You do not need to know the picture of this one. So don't worry about these pictures. And we're getting there, I swear. So we're moving into our worms. Nematodes are roundworms. Again, platyhelminths are flatworms, which are going to include tapeworms or flukes. And we're all about the intestinal system for the most part. There are a few other places, but all about diarrhea again. So we are going to move over to a nice little fluke chart. So these are all the fluke eggs that you are going to have to be aware of. And as I go through, yeah, you need to know all of these listed here. Every single one of these we'll have to know. So this is just nice basic description on each one. Classic characteristics over here on identifying features. So let's go through each one. Fasciolopsis busci is a nice big intestinal fluke. Comes from eating raw vegetation like water chestnuts, bamboo shoots. Lives in your intestine, of course, causing diarrhea. Imagine that. So again, in this case with worms, we're looking for the adult worm or the egg of the worm. And typically we're looking for the eggs. Eggs are easiest, are mostly passed into the stool, and that's what we're looking for under the microscope. With Fasciolopsis busci, it's said to have this small operculum, but it's very small. I wouldn't worry, yeah, here it is. I wouldn't worry about the operculum on this because I'm going to mention an operculum later and I'll explain that. But this is the Fasciolopsis busci. It also looks identical to the Fasciola hepatica egg. So you can call this either the Fasciola hepatica or the Fasciolopsis busci egg. They look identical, so you can't tell them apart. So there it is again, not stained. So again, either one you want to call it out. They look identical. The other one, Metagonomus yakagawai and Heterophes. Heterophes also have the same thing in that they look identical. So you cannot tell their eggs apart either. All right, this is a little word on Fasciola hepatica, which we already saw that egg now. Again, hepatica for liver. This is a liver fluke. So this isn't so much diarrhea as more liver damage and jaundice, that kind of thing, cirrhosis. So again, raw vegetation, just like the Fasciolopsis busci came from raw vegetation and invaded the intestines, liver flukes can come from eating raw vegetation and invade the liver and cause damage there. Again, egg looks just like with Fasciolopsis busci. Clonorchus sinensis got a name change because, God, we love to name change stuff in microbiology. Know it as Clonorchus sinensis because that's what all my tests read out as is Clonorchus sinensis. This is nicknamed the Chinese liver fluke. I would remember that. So as it's called, it invades the liver. Again, coming from undercooked fish or raw fish. The egg on this one, because again, we usually look at eggs, will have this operculum that has demarcated shoulders and then a knob. So if you look at the left end of this egg, there you're going to see the demarcated shoulders. The operculum is essentially like a lid covering. It's like a lid. So it's got this little lid with these little shoulders to hold up the lid. You can see it a little bit better. I know it's blurry, but toward the top there you can see those shoulders and then the lid between it. And then the other side is said to have this little knob that you can see there. So definitely no Clonorchus sinensis. All right, lung flukes, Paragonomus westermani. You need to know it affects the lungs. So basically, if somebody comes in with chest pain, coughing, and it's not a pneumonia, maybe it's Paragonomus westermani. So you can find this in sputum samples. Comes from undercooked crabs or crayfish. And then as far as this, again, eggs found in the sputum. Sometimes you might see the egg pop up in the feces there, especially if they swallowed. And that is Paragonomus westermani. Know that. There's a stain sample. All right, blood flukes. We have 3 ones that like to occur in the blood: Schistosomas, Mansoni, Hematobium, and Japonica. They also, so basically they're found in the veins over the large intestine, bladder, and small intestine. You can examine these in the stool and in the urine, especially hematobium. So where it says here, schistosoma, hematobium, painful urination, hematuria, dysuria. Definitely can link hematobium with the urine samples. I would remember that. Otherwise, causes all sorts of diarrhea, good stuff here, you know the deal. Now, the nice thing is they have these spines that make schistosoma much more identifiable. So Schistosoma mansoni, which can be in the United States but also Africa, has a large lateral spine, so it's coming off the side of it. Very crucial to know these. Schistosoma hematobium, the one that can be also seen with urine, has a terminal spine, so it's at the end of it. I always like to remember the T in hematobium for terminal. And then Schistosoma japonicum, obviously it's found far east like Japan. Very small, tiny little lateral spine. I mean, it's kind of like a joke. If you look at the close-up picture on the right, there it is. My mouse is circling it. Hopefully you can see my mouse. And if you look at the left, if you zoom out, there it is there. It's so tiny. All right, so there's the three together. Letter A is mansoni, letter B is hematobium, and letter C is japonicum. Moving into tapeworms. So ribbon-like tapeworm. I don't know if any of you have ever seen what tapeworms look like. Oh, God, they're nasty. And they get big. It's amazing what can fit inside of you. They get really long. So adult worms love to inhabit the small intestine. You obviously fecal-oral transmission, diarrhea. In the 80s, people loved to use tapeworms for a diet. Crazy. They would willingly put tapeworms in them because it would help them lose weight. That's disgusting. I would rather be fat. Just saying. Okay, so tapeworm has a head, of course. On the head, it will a lot of times have suckers. The scolex basically is just the way that the whole head attaches. And then on the body, it will have what we call proglottids, which are these little segments. Inside these proglottids, a lot of times is how it makes eggs, things like that, different sex organs. It's the body of the tapeworm. All right, so here are your tapeworms. We have Taenia saginata and Taenia solium. They look identical as eggs, so you just have to call it a Taenia egg. But Taenia saginata is considered the beef tapeworm, and Taenia solium is the pork tapeworm. So the way I like to remember that is saginata is a bigger word, so it goes with the bigger animal, the beef. Diphilobrathium latum comes from raw fish. Hymenelepis nana is just another tapeworm. Hymenelepis diminuta comes from green beetles. Diphylidium caninum, just like it sounds, fleas from dogs or cats. So there's a nice little chart, a summary of the description or identifying features of each egg. We will have to know all of these eggs here. All right, so we'll start with Diphilobrathium latum, which again came from raw freshwater fish. So that's what it looks like. This is the one that does have an operculum that's supposed to be more visible. And again, the operculum is like a lid-like covering. So where the arrows are pointing to is where the operculum is. And that's supposed to be kind of the key feature of Diphilobrathium latum. I'm sure you're looking at this going, yeah, right, sure. But there really is a lid there. If you can look, there's a slight line there where the lid is. It's just so slight. You're probably like, okay. Just know there's an operculum there. It's really characteristic for Diphilobrathium latum. If I go to the drawings, maybe here, do you see that line that I was trying to reference up on the drawing? That's what I'm trying to reference for the operculum. So that's the key characteristic. So again, just right there is the line, and right there. I wasn't imagining it. So know that for Diphilobrathium latum. There it is again, and again, the operculum is there. On the opposite side, they have a knob. In this picture, you can see the knob quite well. Okay, Taenia, again, the eggs look identical. So they are going to have this thick shell with radial striations. You see it in bold. I'm going to come back, don't worry, but there it is. You see the radial striations there on the thick shell. Very much know the Taenia egg. Again, Taenia saginata is the larger word, so it's the beef tapeworm. The key to identifying the difference between these two Taenias is looking at the actual tapeworm, because their scolex, their head, is going to vary. So on the Taenia saginata, it has 4 suckers but no hooks or neck. Whereas on the pork tapeworm, the Taenia solium, it has 4 suckers and hooks and neck. So that is the key on the difference between the two Taenias. The other note is, yeah, these are tapeworms. They cause a lot of diarrhea. Taenia solium is also known to cause what we call cysticercosis, which you see in bold. So there's a whole slide here. CDC, I think I have an announcement coming up soon, but they have amazing parasite pages on all of these parasites as you go. You have a project to do in parasites, so I would go to the CDC for help with that. But on the CDC, they have a whole page dedicated to cysticercosis caused by Taenia solium. Essentially, this is where the cyst, instead of like going to the intestines and causing diarrhea, can go into the brain, muscle, and other tissue and cause seizures and all sorts of problems there. So that's cysticercosis. All right, so again, know the Taenia egg. Hymenelepis nana is considered the dwarf tapeworm. It's very small. In this case, the eggs are known to have what we call these polar filaments, so that's a big characteristic there. And then Hymenelepis diminuta has no polar filaments, so that's key in differentiating the Hymenelepis. Again, causes diarrhea. So here's Nana. Inside, on each end, they have polar ends here, has these filaments that come out and kind of fill in the thick part of this shell here. So each end will have it out. So this one's hard to see because it's kind of junky, but they're supposed to be in between the thick shell parts. And then you see here how absolutely clear it is in between that thick shell there. And there again, absolutely clear. So that's the difference between the Hymenelepis. Syphilidium caninum, again from fleas off of dogs or cats. It is literally a packet of eggs. That is its key look. So it looks like a packet of eggs. Yay! Hopefully that one's easier for you. There it is again, a packet of eggs. All right, moving along. We have other tapeworms, which are called Echinococcus. These I do not test you on the Echinococcus. Don't worry about Echinococcus at all. It's mentioned here, but again, I'm not going to test you on that. Now to our nematodes, which are our hookworms. We have two hookworms. We have Ancylostoma duodenale and Necator americanus. They look identical. So if you were to see one of these, you would just say hookworms present, hookworm eggs present, because you can't tell me which one it is because they look the same. So just like they're called hookworms, they're going to penetrate the skin. They hook in from the larvae in the soil. There are other worms. We have Enterobius vermicularis, which is pinworm. Definitely need to know pinworm. You will see this in a clinic setting especially, or sometimes they come in at the ER at night. But pinworm is the one that invades the anus, and they love to come out at night and play, and so it really causes a lot of itchiness on the anal area. And so actually to collect this, we do a Scotch tape method, not fancy. You take some good old Scotch tape, and you tape around the anus area because the female comes out at night and lays the eggs around the anal opening. And so if you just take your Scotch tape, you're not going to do it, the physician or someone's doing it, but they're going to take the Scotch tape and stick it around the anal opening to pick up the eggs off of there. You slap the tape on a slide, look at it under the microscope for the pinworm eggs, and say, yep, you have pinworm, or nope, you don't. So it's that easy. I wish everything was that easy. All right, Trichuris. Trichura is the whipworm. I would remember that. Ascaris lumbricoides is our roundworm. Make sure you know that. Strongyloides stercoralis is our threadworm. This one is unique in that we actually do not look for the eggs on this. We're looking for the larvae. It is passed as larvae. The rest of this is passed as eggs mostly, but Strongyloides is passed as larvae, something to keep in mind. And then again, there's our mention of our two hookworms, Ancylostoma and Necator. There's a nice little summary chart on all of it. You need to know all the way up to the hookworm egg. The end stuff, the rabiniform larvae and on, the only one out of that you have to know is the Strongyloides one mentioned. All right, so we'll go into each one. Again, Enterobius vermicularis is the pinworm. We talked about female laying eggs on the anal area. Gives you anal pruritus, which is just lots of itching, lots of itching. So the adults, it's called a pinworm because it has a pointed tail resembling a pin. But again, we are looking for the eggs, especially on that Scotch tape method. So you can also call it cellophane tape, just so you know. But basically these eggs, there's a little pinworm, but these eggs always have one side that is slightly flattened. And so you see that on the left side here, that side is more flattened. And so that is the key in identifying Anaerobius vermicularis. So there it is again, this time it's on the right. If you go over here, the other picture, it's on the top, more flattened. Trichura, again, is our whipworm, lots of diarrhea here. In this case, the eggs will have what we call prominent polar plugs, which makes it really identifiable. So there's the whipworm. It truly looks like a whip, doesn't it? It's so gross. That's the egg. Look at the polar plugs on each end. It makes it so much more identifiable than others. Students have always thought that this looks like a casserole dish, you know, like the polar plugs are the handles. And so they used to have a little thing like you're going to whip up a casserole so that you knew it's the whipworm. So there it is. That should be very identifiable to you. Roundworm, again, Ascaris lumbricoides, more diarrhea. It has a thick, transparent shell. Looks like an earthworm, kind of. But that's kind of what it is, that bumpy little shell there. That's the roundworm egg. But it should be more transparent like this. In that case, it looks kind of a little bumpy. But. And then again, hookworms, we can't tell them apart, so just call it a hookworm egg. And that's why it's called a hookworm, is it's showing you how it hooks there. But there's the hookworm egg to definitely know. Do not get this confused with Diploidium caninum, which is a packet of eggs. It is different. Be careful that you really look at it closely there. It's not so egg-like here. It looks initially like it might be, but it's not. And then again, Strongyloides stercoralis is the one that's passed as larvae. It is not passed as an egg typically. So lots of diarrhea here. Again, so there's the larvae form. That's what we look at for Strongyloides, so make sure you know that. There's a nice picture of it. Okay, moving on to worms that are found in the tissue. So Trichinella is commonly found in the muscle. You get it from eating raw pork, and yes, raw bear. So the nice thing is it's nice and spirally looking, and so that's the key with Trichinella. Very unique look to it. And to diagnose it, of course, we're going to take a tissue biopsy, a muscle biopsy, because that's where it's going to be found. So this is what a muscle biopsy would look like. It's hard to see in this one, but in the center here is where it's starting to be Trichinella. It's not as spirally looking in this biopsy picture, but that's what it is. And then finally, other worms. We have Brucei, Malaria, Wucheria, Onchocerca, Loa Loa. We have to know all four of these. So these are very unique in that they have what we call these sheaths to them, or non-sheaths, and that will differentiate between them. So Wucheria bancrofti is sheathed, and these nuclei, these are little nucleus. These nuclei do not come to the edge. They have a little space there, so that's unique for it in the worm. Because we are going to look for these actual microfilariae, or worms, in the blood. We will see this under the microscope in either the lymph system or the blood system, or the bloodstream, I should say. Brucei malaria is sheathed, and the nuclei will come down toward the end more. Loa Loa, again, sheath will extend all the way down. They're more separated in Brucei than they are in Loa Loa. And then Onchocerca is unsheathed. There's not an extra sheath there. So we're going to go through each one. Each one is passed by a different vector that you have to remember. So Wucheria bancrofti is passed by mosquito down in more Central America, South America, and this is what causes elephantiasis. I'm sure some of you, at least one of you, has heard of elephantiasis before. But essentially, when you get this passed to you, this will go and infect the lymph nodes, the lymphatic system. And you have lymph nodes all over your body. And so what it does is it will go and settle in one of those lymph nodes and cause extreme inflammation. It usually really likes the lower limbs and the genital area, unfortunately. So it'll cause what we call elephantiasis, or extreme inflammation. So like there, you can see the extreme inflammation by it infecting those lymph nodes. Okay, now I'll go back to the slides I skipped. All right, again, diagnosis, you can see this in the lymph fluid under the microscope. Again, the nuclei do not extend into the tail, so there is a tail over here that they do not. So this is right what it looks like. Do know that. There's more, so you can see again the tail. This one you can't see the tail on the right, but it's cut off there, but it's there. Okay. All right, Brucei malaria. That's not what I see. It's very common. similar, I should say, not common, very similar to Wucheria bancrofti. Again, the nuclei get more separated into the tail, it will go all the way down to the tip, but it's more separated nuclei to the tip. I really don't test you on this one a lot. Just, it's there, it's part of the family, but I don't test you as much on it. Loa loa, you definitely need to know, is the African eyeworm, and so it will infect the conjunctiva of the eye. And so with this one, the nuclei do extend all the way to the tip of the tail. And there is Loa loa. So it goes all the way to the tip down there. Again, all the way down to the tip. It's harder to see on that one. And then Onchocerca volvulus causes river blindness. Again, know that. Passed by the black fly as the vector. And so this obviously settles in the eye tissue, the ocular tissue, causing blindness. And there is a little bit of a section of tissue with Onchocerca volvulus, or you can actually see it in the lady's eye, or gentleman, whoever it is. They're just little microflare, unsheathed. Oh, so gross. I want to just go back to that chart. Sorry. All right, so this is telling you the vector. Remember I said there's vector. Wucheria is mosquito, Brucei is mosquito, Loa loa is fly, Onchocerca was fly, just to keep that in mind. Okay, now let's see. I think we're all done with our parasites. Oh my gosh, so many, so many. All right, as far as samples go, like I said, there are so many of these that are just diarrhea, basically, that we'll just get a stool sample. The best way to get a stool sample to detect for parasites is doing it over a 10-day period. Trying to get 3 samples on different days usually is the best way to really make sure that you can screen for parasites well. So there's different preservatives that can be used in the fecal samples. You do not need to know these, just they're informational. Again, you can look for intact worms in the stool if they actually pass the worm. That can happen. But otherwise, we are looking under the microscope. What the rest of this we'll talk about is there is a different consistency of stool and what you may find based on that consistency of liquid or formed. So there's like an actual chart of this, which I find interesting, that if the more liquid it is, the more trophozoites you're going to see in the stool instead of cysts, and then the more formed it is, you'll see more of the cyst stages instead of trophozoites. That's what it's saying. Okay. All right, there is different ways to do microscopic exam. You can do wet mounts, concentrates, stain smears. So all this information is here. Again, I do not test you on this information. It is just really, it's just good to know in case you ever have the ability to work in a parasitology department. So I'm just going to skip through that, but it is there again. All right, oh my gosh, exhausting. I know, I'm exhausted listening to myself. But the nice thing with parasites to remember is disease-wise, there wasn't a ton to know disease-wise. Yeah, I mentioned a couple things here and there like, oh, Onchocerca, river blindness, but that's all you really had to remember with it. And then it's the pictures that you need to get to know. So remember any little key bolded things I stressed, maybe a mention of a disease here or there, and you should be good to go. So that's it for this week. I think we've had plenty. I hope you guys have a fabulous week too.